Welcome, everybody. So it's very exciting. I see lots of familiar names. I don't see any familiar faces. Let me tell you, it is a little bit strange talking to people with just a screen in front of you and nothing else. Super, super bizarre. Anyway, thank you everybody for showing up. This is fantastic. So as a lot of you may know, irritable bowel syndrome is one of my passions, and I wanted to get on here today and share information with you. I know it can be super frustrating living with irritable bowel syndrome, and so I wanted to get some information out to you and also to let you know about some new programs that are going through the clinic right now. So I just want to send out some reminders. This is being recorded, so if you miss anything, if you want to come back and look at it later, we're going to be sending out the recording afterwards. So feel free to come back and take a look at it. This is just for educational purposes. I'll be sharing lots of great information, but it's really not meant to diagnose or to treat you. Only somebody who knows you well can do that, like your doctor or your naturopathic doctor. So just keep that in mind. And I cannot give treatment advice that's specific for you. So I know there'll be an opportunity to ask questions, which I am just looking for right now. The Q&A area is right there. So I will answer questions for sure, but if it's really specific to you or your treatment plan, I will have to reach out to you afterwards. So just send me an email and I will do that. And then please stay to the end. We'll be probably about an hour. And at the end, I will be telling you how you can get a free consult with me. All right, let's get into it. So irritable bowel syndrome. Irritable bowel syndrome is the most common gastrointestinal diagnosis, which is pretty amazing when you think about it. And it's estimated to affect 20% of Canadians. That is a lot of people, which is why we have so many people on this webinar today to figure out what are we going to do about it. So the signs of irritable bowel syndrome, I'm sure, are all too familiar to you. Stinky gas, constipation, diarrhea, bloating, abdominal pain, and cramping for sure. Those are kind of the most classic symptoms. So I want to try out this poll feature, which I think is pretty cool. I want you guys, because I don't get a chance to talk to you and see your faces, I want you guys to tell me what is your most troublesome irritable bowel syndrome symptom. So let's see here. So you guys go ahead and select which one. And if there's more than one of those, then please go ahead and select more than one. I'll give you a couple of seconds to do that. Amazing. Almost everybody has voted. A couple more people. Fantastic. Great. Awesome. So wow, it's really, really across the board. I would say 50% of you have bloating, which is not surprising. And then flatulence, passing wind, gas, farting, tooting, all the different ways to call it, comes in second at 39%, and then abdominal pain. But a lot of you guys have all of these symptoms for sure. So those are the results there. I'm going to share them with you. Awesome. So I want to find out from you guys, how often are you feeling these symptoms? Is this something that's happening once in a while, or is it something that's happening a lot of the time? Poll number 2. Let's do that one. All right, you guys can tell me how often this is happening. It gives me a sense of who I'm talking to and what is going on. Okay, awesome. I can see almost everybody. Just wait for a few more people. Fantastic. Okay, so here's the results. Always daily, 50%, and then often 1 to 2 times per week. There's nobody on this webinar who can eat anything they want. That does not surprise me. And then occasionally 1 time per month. Amazing. Thank you guys so much for sharing that. So one of the questions that got submitted, we got some really awesome questions coming in over the last few days when I said I would give this talk. And a lot of the questions were, well, what is a normal digestive system? I know that I have irritable bowel syndrome and that I'm having all of these symptoms many, many times a day, but what is actually a normal digestive system? My poop chart, anyone who knows me knows that I love my poop chart. And the best part is somebody actually made a cake version of the poop chart. That person is my hero. So what I'm going to do is ask you to see if you can figure out what a normal poop is like. Let me grab this one. So which number on this chart is what you think your poop should look like? Thinking, people are thinking, okay, good. Amazing. It's really cool. You can see everybody who's voting. Zoom is definitely making money. I'm just saying. Okay, fantastic. Some people, oh, there we go. We'll give you guys a few more seconds. Awesome. All right. So you're all a bunch of smarty pants. You are right. It is number 3-4 is the normal one. And then how many times per day should you have a bowel movement? Some said once a day, and some of you guys said twice a day, and some of you guys said 3 times per day. And that was generally the consensus. Amazing. So let me share those with you guys and close that up. All right, so stool type, you got it bang on, number 3-4. The stool shape should be well formed. We shouldn't be seeing this mushy mess that breaks apart when you flush the toilet. So really it should stay in the shape of, what is that? A Twix bar, maybe? I'm not sure what that is. What is it supposed to feel like? It's supposed to feel easy to pass. There should be no straining. It should not be really difficult. You shouldn't have to sit there and read an entire magazine while you're having a bowel movement. And then what about the good old undigested food? Oh my gosh, there really should not be any undigested food in your stool, with the exception of corn and seeds. So we know in nature, that is how nature puts its little things into the ground to sprout up those plants. So it is normal to see those. I often get people freaking out because they see flax seeds in their stool. That is actually pretty normal, and corn too. But anything other than that, if you're seeing bits of lettuce and tomato hanging out in your stool, that is not normal or healthy. Gas. How much gas is too much? So when we're talking about burps coming up and out of your mouth, 3 to 5 times a day is pretty normal and common. It really should be pretty minimal unless you're drinking a ton of carbonated beverages. Now the other end, the farts and the toots, 5 to 15 times per day is actually pretty normal. And it tends to happen more first thing in the morning when we wake up. We have all that gas sitting there trapped and it has to make its way out. So don't expect that you're never going to fart again. I promise you that is not going to happen. Everybody has a liter of gas inside of them, but 5 to 15, not constant throughout the entire day, which I know is the case for a lot of you. Color. So what color of your poop is normal? A little bit of green is okay. So let's say you're eating a lot of kale or spinach. That's normal that it's going to change the color of your stool a little bit. If it's getting into this zone where it's a super green, it probably means you need to slow down in terms of what you're eating. Black is generally not a good thing unless you've taken a medication like bismuth will turn your stool black, or iron supplements. But if it's happening naturally, that's not a good sign. That could mean a sign of blood up inside the digestive tract, and you need to let your doctor know about that. Very pale stool is also not a great sign. It could be a sign that your bile duct is blocked, so you want to pay attention to that. And then the good old red, I see a lot of concern about that because people often eat beets and that will dye our stool red. But otherwise, if you haven't eaten beets and you're seeing red in your stool, that definitely needs to be brought to the attention of your doctor because that usually signifies bleeding. And then yellow is very undigested. It's passed through pretty quickly. And so that might indicate a malabsorption like celiac disease, for example. And then brown is what we're looking for. So any shade of brown is fantastic. Okay, question for you guys. How long should it take for your food to move through you from your mouth to your anus? Let's see if I can get my poll going here. Okay, I give you guys a few seconds to answer that. How long should it take for food to move through you? Amazing. Okay, I'm going to share the results with you guys. So you guys are a bunch of smarty pants. Very good. 18 to 24 hours. That is the normal transit time. So let me just close this up here. 18 to 24 hours. So some of you might be wondering, how am I going to know how long it takes for food to pass through me? Well, there's a simple little test you can do. You literally just eat something that you're going to be able to track and see how it passes through you. So then you can tell when it shows up inside of your toilet bowl. The best things to try are those things that I just told you are normal to show up in your stool. So corn, whole sesame seeds, or even grated carrot. The key is to eat them first thing in the morning when you wake up so that you kind of have an empty stomach. A good amount, like 2 tablespoons or so, and then you time how long it takes for the stool to show up. So just mark it down on your daytime or whatever. You know, I ate them at 8 o'clock in the morning, and you should see them show up by the next morning at 8 o'clock or that next bowel movement. It's a fun little test to do. This is the kind of thing that I do a lot in the groups that I'm starting. And so part of the information today is about my Gut Reset Sisterhood, which is a 6-week program where I work with patients in a small group setting. And we do all kinds of these fun things together to figure out, do you have a normal digestive system or not? All right, so I'm going to share a little bit about my personal story and why I am a little bit obsessed with bowels and farts and gas and bloating. It's kind of, I guess, a weird thing to specialize in, but the reason why I specialize in it is because I can completely sympathize with everything that you guys are writing here. Warning, this has way too much information in this story, but from as long as I could remember when I was little, you know, and then a teenager, 12 years old, I basically carried a change of clothes in my backpack or my purse everywhere I went, and baby wipes. And anybody who has irritable bowel syndrome will totally understand why a woman needs to put baby wipes in her purse. And that was kind of just my life. And I would make excuses oftentimes about not going to friends' houses to eat. And I would always be afraid to eat at restaurants all the time. And generally, I would just wake up in the morning wondering if today was going to be a good day or a bad day, which is a really crappy way to start your day. And so you might be asking, why was I carrying baby wipes in my purse or my backpack and a change of clothes and being careful with menus and at friends' houses? Well, it was because out of nowhere, I would get these crazy intense digestive symptoms, spontaneous diarrhea, crippling belly cramps, the worst farts that could clear a room. I also had a lot of headaches, which a lot of people don't associate with IBS, but it is definitely common. A lot of heartburn and reflux, not so much GERD, but more just the burning. Terrible fatigue. I felt like I was 95 years old all the time, and asthma and lots of anxiety. So that was most of my life, honestly. Oh, of course, the TMI component. I forgot the anal fissures. So, of course, I went and sought help. I tried to get some answers, and I was told that you just have IBS and everything is normal. So you need to eat more fiber and you need to learn to relax more, Jen. So I did what I was told. I ate more fiber, and that gave me more diarrhea and cramps. And then I learned to relax. I took up meditation and yoga, which I do love still to this day, but I still had diarrhea and cramps and farts. So then I kind of made the conclusion that IBS is a load of BS. And at the end of the day, irritable bowel syndrome just means that your bowel is irritated. It doesn't tell us anything about how to fix it. It's really like saying, I have headaches. Well, what is causing those headaches? And so I was super frustrated. I was frustrated with my body. I was frustrated with the healthcare system. And the only thing to do when you're frustrated is to become a naturopathic doctor. And I just wanted to find the answers out for myself because I felt like nobody was going to help me unless I did. The good news is that all of you guys don't have to become naturopaths because I'm going to share with you a lot of the strategies and tips and things that I share with my patients for how to treat their digestive systems. But that was the path that I chose to take. And I started to really ask the real question, why is my intestine irritable? I'm really happy to say that I found out my why and I solved my IBS mystery. And I've spent the last 10 years working with patients to do the exact same thing. So that is why I am so passionate about irritable bowel syndrome. So my mission today with all of you guys on here is to help you understand what is truly causing your IBS. I want to share with you how to properly get tested and treated and sort of the process of working with me and how I treat IBS. So I want you guys to start asking yourselves the real question, why is your intestine irritable? I don't want anyone anymore to take for granted, oh, I just have IBS, there's nothing I can do about it. I want you to start to figure out the why. So we're going to take a few minutes to kind of debunk a few myths, the top 3 things that I hear over and over again. A lot of these came about also because of the questions that came in over the last few days. And so I wanted to take a few seconds to kind of clear the air on a few things. All right, myth number 1. IBS is a psychological disorder, which is basically a nice way of someone saying it's all in your head. I hear this all the time, and it breaks my heart because it's not a psychological disorder. It's tricky to diagnose because there's not one specific test for it, or you can't just take a sample and see this and that. And that's where it gets a little bit tricky, but it is definitely not a psychological disorder. Now, the question is, do anxiety and depression play a role in it? Absolutely. If someone is anxious, let's say they're going to give a big talk in front of a whole bunch of people, of course the digestive system is going to start to move and get into a bit of fight or flight, which will feel perhaps like you have to have a bowel movement or you have loose stools or you have bloating. But that is rarely the underlying cause of irritable bowel syndrome. Myth number 2. You need to eat more fiber. I get this one all the time from patients saying, oh, I was just told I need to eat more fiber. This is really not true for most people with IBS. So most people with irritable bowel syndrome actually feel worse when they add more fiber to their diet. And we're going to talk about why in a few minutes. Myth number 3 is it's all your hormones. And this is why I really focus a lot of my treatments with women because of the hormonal component that comes in. So it's not all because of your hormones that you have bloating and gas and everything else going on. It is actually something else going on with your digestive system. Now, it's true, hormones can play a role in it, right? Before a woman has her period, for example, the uterus is really activated and it's going to start contracting to get rid of that lining. Well, guess who's hanging out right next to that uterus is the bowel. And so, of course, it's going to get activated at the same time. So it is normal to have diarrhea and a bit of bloating and loose stools around the time of menses. But that doesn't explain why it's happening all the rest of the month. Now, what about progesterone and estrogen, Jen? So yes, of course, those can make us feel bloated too. And some women might experience that when they're on something like a birth control pill. But a woman who's not on any of that and who doesn't have their period often will still have all the things that you guys are describing, like the bloating and the gas and everything else. And it's because it's due to something else going on and not just hormones. All right, so you guys are like, okay, you took away the 3 things that I thought was causing it. What is the most common cause of irritable bowel syndrome? It is Sibo, which stands for small intestinal bacterial overgrowth. So Sibo, honestly, when I went to medical school a long time ago, like 20 years ago, this wasn't even in the curriculum. No one talked to us about Sibo. It didn't even really exist back then. It hadn't been identified as a condition. In the last 10 years, there's been a lot more information that has come out about it, which has been fantastic. So 30 to 50% of irritable bowel syndrome is actually caused by Sibo. And there's always more studies coming out. Some of them report it higher and some of them lower. But at the end of the day, it is a huge, huge, huge factor in irritable bowel syndrome. So you're saying to me, Jen, what the heck is Sibo? Why should I care about this? Why are you talking to me about this? I am so glad you asked. I'm going to tell you a short little story. So I actually put this story together to explain Sibo to little kids in my office. And at the end of the day, I've ended up really loving it with adult patients just as much as I do with kids. Now, in order to do this story properly, I need a prop. One second. Okay, I can't see myself, so I am going to check with my amazing office manager, Maya, and she is going to tell me if I am visible or not. All right, let's see here. You sure are, she says. Amazing. Okay, so this is literally my favorite apron of all time. How many people have a digestive system apron in their house? Really? So once upon a time, there was a human, and you know, the system might seem pretty complicated, but at the end of the day, basically what we have going on is a tube. One ginormous, super long tube that goes from our mouth all the way down here through the stomach, connects to the small intestine right here. Oh, where is he? There, it's the beginning of my small intestine, all the way down 22 feet, connects to the large intestine, which goes up, over, down, and out. So essentially we are one ginormous tube. And I always think of those party balloons like the clown has when I think of people's digestive systems. This is Bob. Bob is a gender neutral organism and it is everywhere. They are everywhere. Bob really gets around. So think of Bob as sitting on your food all the time, on your toothbrush, in your mouth, basically hanging out everywhere. This is bacteria, right? We are surrounded by it all the time. So after entering our mouths, Bob is ready to start his big journey through the human tube. And the first stop is going to be the stomach. This is the best part about this is you can actually hold your stomach in your hand. Now, I want to ask you guys a question about your stomachs to see how knowledgeable you are. Let me see if I can find this poll here. There we go. Okay, I want to know if any of you have ever tested your stomach acid levels. Thinking about it. Okay, let me share that with you. So 59% of you have. Amazing. And when you tested it, low was 47. So 47% of you had low stomach acid. So that's pretty common to have low stomach acid, especially kind of with the lifestyles we have these days. We don't do a lot to support our stomach acid. But the reason why this is so important is because, let me just close that up. The reason why that's so important is if you think about Bob coming down the hatch, and then gets to the stomach, you need adequate stomach acid to actually kill Bob. Otherwise, Bob is continuing on its journey, and that's exactly what's happening in this story. So next stop is the small intestine, but the beginning of the small intestine, which actually, they go right here. Right here, it basically is a mix of your bile from your gallbladder and your pancreatic enzymes. So I have another question for you guys. Let me grab this one. See how well you know your bodies. Okay. Do you make enough pancreatic enzymes to digest your food? No, not sure, or definitely. Awesome. Let me share that with you guys. So 73% of you are not sure. And it's really important that we understand whether or not we need digestive enzymes and for which kind of foods we actually need them for. So we have enzymes that break down protein, enzymes that break down carbs. There's different enzymes for different kinds of food. And this is a lot of the stuff that I end up talking with my patients about and that we end up covering in the group sessions. All right, let me close this. We're going to move on. Bob's had quite a busy day. So far, Bob has escaped the stomach and the bile and the small intestine. And the next stop is he's going to slide all the way down the 22, check this out, 22 feet of the of the small intestine. Look at this. Isn't that amazing? I don't think that's actually 22 feet, but literally so much surface area in there. The final stop is Bob shows up in the large intestine. Think of this connection here. Here's your small, here's your large, boom, they connect together. And this is where we want Bob living. We want Bob living in the orange part in the large intestine, where there's about 1 trillion bacteria living. It's crazy how much is living there. The insane piece of all this is that when we look at the small intestine, there's actually not a lot of bacteria living in there, which means all of the bacteria that we're eating is traveling 22 feet all the way down through the small intestine, not stopping, keeps on moving, then hops into the large intestine, and that's where they're supposed to set up their colonies and exist. In my story, Bob is a little bit adventurous and decides to wander backwards into the small intestine. Looks quiet in there. It's like kind of empty compared to the large intestine. And so Bob ignores all the warning signs and basically sets up a home in the small intestine. Soon after, a whole bunch of Bob's friends follow and they set up in the small intestine as well. And pretty soon we have an overgrowth, a small intestinal bacterial overgrowth. So the crazy thing about Bob and its friends is they eat a lot of food and they fight over food all the time. Bacteria need to feed just like we do. So the favorite foods that they love to eat are apples and pears, lentils and chickpeas, garlic, and onions. Basically anything healthy with loads of fiber are their favorite foods. So I want to ask you guys a question about what foods seem to cause you the most trouble. Which foods do you seem to react to the most? Sugar, apples, chickpeas, meat, lettuce. Amazing. Okay, I'm going to share those results with you guys. So look at that. Carbs is definitely one of the winner, 39% pasta and breads. Nobody reacts to meat, very little to lettuce, and then chickpeas and sugar come in a close second. So one of the questions I got a couple days ago from someone who's attending the webinar. Hopefully you're listening and you're going to hear this answer. She wrote, "Why does my belly get bloated past my boobs when I eat sugar?" And I hear that all the time from people. And it's funny and it's sad at the same time. But the reason why is because of that picture. Those bacteria really love eating the sugar. They just ferment essentially when they get their hands on those types of foods. And so the more fibrous types of foods you're eating, the more you're actually going to bloat when you have something like Sibo going on. If you don't have something like Sibo, then those are the healthy foods. Those are all the things that I basically want people to be eating, is apples and chickpeas and things like that. But for people who have Sibo and have bacteria living in the wrong section of their intestine, all you're doing is feeding those bacteria when you're eating those foods. And so we call those high FODMAP foods. Each letter is an acronym, or it is an acronym. So each letter stands for something: fermentable, monosaccharides, and polyols, which is basically all of these things down here that you can see. So that's why carbs and pasta cause a lot of problems for people. Lettuce and meat, not so much. There's really no fiber in lettuce and meat. There's no FODMAPs in there. There's no food for the bacteria to munch on, essentially. So I do have a handout which you guys can download. You can either write down my link tree, or maybe if Maya's still around, she can drop the link inside the chat so you guys can copy and paste it. But I have a nice little guide that just shows the top 5 foods to avoid if you're wanting to get started on a bit of a low FODMAP diet. All right, so what happens? We're feeding the bacteria in the small intestine. Well, pretty quickly, the small intestine will start to fill up with a ton of gas. The walls of the intestine start to become damaged and inflamed. And these are the 3 gases that are mostly to blame. So we have methane, hydrogen, and hydrogen sulfide. Causes a ton of pain. The organisms are super happy. Stinkier the better. Not so much the poor human. And those are the 3 gases that get produced: the methane, hydrogen, and hydrogen sulfide. Maya's telling me to tilt my camera down a little bit. There we go. Is that better? Awesome. So it produces a ton of gas. Each gas is very powerful and toxic and just feels terrible. And as the gas grows, well, guess what? So do you. If I had 5 cents for every time a woman has told me that she looks pregnant but is not pregnant, I would be a very wealthy person. So it basically leads to bloating and cramp and makes you feel like you've got this pregnant belly. The really interesting thing is that depending on which gas gets produced, you get different symptoms. So somebody who produces a lot of methane actually gets more constipation. And somebody who produces more hydrogen gets a lot of diarrhea. And if you have hydrogen sulfide, you get a mix of both constipation and diarrhea. So here's a picture of me doing my first Sibo test a long time ago. And this is one of the ways that we test for Sibo. Well, it's the only way, really. It's a breath test that takes a couple of hours to do. It's pretty simple. Blow into a tube. Then you drink a sugar solution, and that's what feeds the bacteria. So if you do have those bacteria living in your small intestine, if you drink the sugar, it's going to start to move through your small intestine. Let's say you've got a pocket of bacteria living right here towards the top. Well, when you breathe out after 10 or 15 minutes, you're going to put out a ton of hydrogen methane from your breath, and it's going to get captured in those little tubes. And that's what they send us the results of. And so this is essentially why I started creating group programs around this, because I've become well known for treating Sibo and IBS and lots of other digestive issues. And one of my frustrations has been not being able to see as many people as I want. And so I decided, let's do groups, get people together, and also to learn and hear from each other, because there's so much wisdom that comes about when we're starting to share our stories and see what works well for this person and works well for that person. I repeat myself a lot, which is why I also chose to do this webinar. I feel like I have been trying to explain this connection between IBS and Sibo to a lot of my patients over the years. So I thought, let's just get the word out there to everyone, because I want you to know that this is a condition that can be treated and you don't have to just live with it, which is often what I hear. So I always use natural methods in my practice for the most part. When I'm treating things, I really go with a lifestyle approach. So I might use herbs. I use a lot of stress management, all kinds of different tools, which I'll tell you guys about a little bit more. The end of my story is she lived happily ever after, and our friend Bob did not. Rest in peace, Sir Bob. These are the 3 Sibo types that we just covered. And this is a handy little checklist just to see where your symptoms might line up. I don't want you to go ahead and diagnose yourself or anything, but you can kind of look at it and see sort of where you're falling. If you have a lot of the methane type symptoms, you're going to be more constipated. And if you have a lot of the hydrogen type symptoms, you're probably going to have more diarrhea. And if you have both gases, you're going to tend to have a mix of constipation and diarrhea. So you'll probably alternate. The really annoying thing about Sibo is it does cause damage to the gut. And so we do end up with food sensitivities as a result of having Sibo. So I find often patients will come in and say, oh, can I get tested for food sensitivities? And I'll often say, well, perhaps we should start with looking to see if you have Sibo first. So otherwise, you're just stuck cutting out those foods for the rest of your life if we don't treat the root cause, which is often Sibo. Some of you may have B12 deficiencies or iron deficiencies, and that's also often caused by having the inflammation in the gut and then a malabsorption. So you can't actually absorb a lot of the nutrients from the food that you're eating. So these are the top 10 signs of Sibo. Very similar, obviously, to irritable bowel syndrome because they are essentially the same condition, but a little bit more of the nutrient deficiencies with this. It goes on. It's not all that it causes. It causes a lot of really weird symptoms. So when I was describing to you guys earlier about the anxiety, you wouldn't necessarily think, why would I have anxiety if I have Sibo? There's a lot of ideas as to why that comes about, but it's definitely well documented that patients with Sibo tend to have more higher rates of anxiety and depression. It can also cause joint pain or rashes, or really any inflammatory symptom can be attributed to it. So this is a fun little tool I use in my practice and with my group participants. It's called the Symptom Severity Score. So I dropped the link there for you guys if you want to try it out for yourselves. I'm a huge fan of tracking symptoms to see as objectively as we can how things are progressing. It is amazing how many times people forget how they felt 3 or 6 months before. They forget sometimes that they actually felt worse than now. So I often use the symptom severity score as a way of tracking progress. And so you can go in there and just fill out the form and it'll give you a score. And then after starting a treatment or making some changes to your life, you can go back and take your survey again or your severity score again and see how things have progressed. So we will be sending all these links out afterwards, and I'll put it in the follow-up email along with the video so you can do that if you'd like to. So Sibo has many different causes, but the #1 cause of Sibo is actually getting the stomach flu. And if you think about it, let me grab my small intestine again. So if you think about it, when you have something like the flu, you're probably vomiting, right? And there's a tremendous amount of pressure that comes up here. So we have a connection between the large intestine and the small. There's actually a little valve here. And this valve is called the Ileocecal Valve. And what happens sometimes if we have really severe vomiting, we might actually push the contents of the large intestine into the small intestine and blow past that valve. And so that's why that tends to be one of the most common causes of Sibo. There is a lot of other causes too, which we will not go all into. Yeah, there's a lot of things that can cause Sibo because it's one big tube, right? And so anything that causes the bacteria to get displaced can cause Sibo to occur. So you're probably wondering by now, how does Jen treat Sibo? What did she do for herself? All of these things. Let me put my small intestine down. The way I want you to think of it is think of your gut like a garden. So if you have irritable bowel syndrome or Sibo, your gut kind of looks like this. It's not in its best state, right? But I actually want your garden to look like this, where it's flourishing and full of life. So we don't want bacteria in the small intestine, but we do want it in the large intestine. And we want to heal that inflammation and really reduce things so that you start to get rid of some of those inflammatory symptoms that you're feeling. So this is how I treat Sibo. I treat it in 2 steps. The first step is really 6 weeks as a group. We can do it. When I'm doing it one-on-one, it often takes 6 months because I only see people typically once a month in practice. But as a group, we can get it done a lot faster, which is why I love doing the group treatments. And that first step is really laying down the foundation to make sure that your gut has all of the things in place. So the questions I asked you guys about your enzymes and your stomach acid and all of that stuff, what food you're eating, those are all the things that we cover in those first 6 weeks. We work on your pH, we work on stress levels. It's really an amazing 6 weeks together. And then step 2 is where we actually go in and start killing the bacteria, if that is the case for you. If you don't actually have Sibo, then that first 6 weeks will be an amazing program to just kind of reset everything and put out the fires and learn so much about your digestive system. You probably won't need step 2. For those of you with Sibo who think you have Sibo, then you'll go on to do a second program, which is where we actually kill the bacteria together. And I use herbs for that in my group programs. So this is where I want to tell you guys about this amazing group that I've put together. I launched it a couple of weeks ago for the second time, and it's almost full. So I have a few spots left. I am debating, I might be willing to open a second group depending on how much interest there is. And considering 100 people registered for this webinar, I think there's a lot of people out there who are struggling with IBS and Sibo. But the idea behind the group is that you spend 6 weeks with me and a small group of women. So we get 90 minutes together every week over Zoom, like this, but live in a meeting style. So we can see each other's faces and participate and chat and everything else. You get 6 weeks of medically supervised treatment plan, which means I tell you exactly which products to take. You're not going out shopping and looking for everything. I literally deliver, not myself, but we deliver the box of supplements to your door so you don't have to think about anything. And you have a treatment plan that is included with dosages and everything. And the best part, honestly, is that every week we get to spend an hour and a half together and I get a chance to answer all of your questions. The number of questions we got over the last few days tells me people have a lot of questions. And oftentimes in one-on-one visits, we don't really have that time to cover that together. So you may be asking, why group medicine? Honestly, it's a win-win. You know, I get to treat more patients and help more people. I hate having a wait list. I love having a wait list, but I don't love having a wait list. It's stressful. And so I get to offer this group medicine at a lower cost to you, and you get the benefit of having this community of people around you. We have an amazing chat software that we use that's a HIPAA compliant chat software. And so all the participants can chat together. It's not Facebook, it's nothing like that. It's a totally different software. So even if you don't love social media, you're gonna love this. And then everybody can kind of contribute and chat between sessions. And there is also a lot of evidence to show that we heal better in community than we do alone. It's also a pandemic, and I feel like we all could use a little bit more support from one another. So this is a great way for us to get together in a safe way. So you might be wondering, what are we going to learn over the 6 weeks? This is just some of the things you're going to learn. You might be wondering what's causing your constipation or diarrhea. So you'll figure that out hopefully during the 6 weeks. Do you have food sensitivities? Why do you feel so bloated after you eat? Are you sabotaging your digestion? There's a lot of times things that we do that actually takes away from our ability to digest, and we don't even realize what it is that we're doing. Which tests should you do? I get asked that question a lot of times. Should you do the Sibo test, food sensitivity, a stool test? Does your body produce enough enzymes? Are you missing any nutrients from your diet? We really get into your diet in a very specific way and look at it and see, do you have enough potassium? Do you have enough vitamin C? Do you have enough calcium? All of those things. What are your health habits and how can you set goals? Every week we set goals together to kind of get you moving forward and actioning on things. How does your mood and your mindset affect your bowels? Should your diet change with the seasons? What balance of macronutrients does your body thrive on? Are your gallbladder and liver affecting your digestion? This poor little guy down here. What is your transit time? Hopefully you'll do that little test and see. How much raw food should you be eating? And do I need to take probiotics? I get a lot of questions about that. So we actually go through that together. We do a probiotic challenge. I give you sample sizes of each one because not all probiotics are the same. And it's really important that we don't just say probiotics, I took them and they didn't work, or I took them and they made me bloated. Because for some people they work super well, but it depends which strain of probiotic you're actually using. So this is what you get over the 6 weeks. If you join my program, you get the 6 90-minute sessions with me. And sometimes Ginger joins in too because she's a baby girl and she likes to hang out with us. I'll answer all your questions every week. There's lots of time for Q&A. People send in questions before, and then it's just very casual, open mic type of situation. Because we're a small group, I'm limiting it to 12 people. I want to give lots of attention to everybody. We talk about what tests, we go over the treatment plans, and then you have an app to track your symptoms as well. I give you guys a 28-day meal plan. It is based on low FODMAP. It's not necessary to do low FODMAP to do the group though. The beauty of this is that we end up customizing a lot of things to you. And so the plan is there, and then we can work off of it based on what works for you. And the best part is the 6 weeks of supplements, because I like pretty things and we make it really fun. I throw in a few gifts for you guys, but the best part is you do not have to think about what you're going to be taking for the program. You're not running out to a health food store to get everything. So literally just done for you. I wanted to show you guys quickly, this is the software that we use to do all of our tracking and everything. And so it's kind of fun because you can track your bowel movements. You can say if you were active, and it's just a really nice way of tracking your progress. And I get to see everything, so I can help you figure out patterns and make connections. This is our class schedule. So we meet, right now we're meeting on Wednesdays, starting on March 10th from 1 till 2:30. The 90-minute session rolls like this. I usually start with an opening meditation just to kind of get everybody settled in and leave the day morning stuff behind us. We do a check-in, and then we start to learn something about your gut. We talk about a new treatment that we're going to try together. Lots of time for Q&A, go over the treatment plan that we have coming up for the week, set our goals, and then we check out. The 90 minutes fly by, but it is so much fun. I have really loved having this extra time with my patients. So you're probably wondering, is this for you? Should I join the gut reset? People have been asking me, oh, I don't know. I'm not sure if I'm a group person. So this program is for you if you worry about what you are going to eat and what it will do to you every darn day, just like I used to worry about all the time. If you worry about where the nearest toilet is, if you have a mind map of every toilet in the city that is open during the pandemic, this is a good program for you. And if you're bloated to the point where it looks like you're 6 months pregnant, but you're not actually pregnant. I'm being a little facetious, but honestly, those are kind of the criteria. It is not for you if you have a flat belly and have never had cramps and pain, if you have normal, beautiful type 3-4 poops, and if you can freely eat food without thinking about or analyzing it, you do not need to be part of this group. So some of the frequently asked questions I get from people is, I have Sibo, is this the right program? This is exactly the right program. So previously I ran it as a long 12-week program, the Sibo Sisterhood. I decided this time to break it up into 2 parts because not everybody has Sibo who has IBS. It's not 100%. And so some patients do actually benefit from just doing the gut reset without having to do the second part. And I wanted to give people that chance. The second thing is, you might find, even if you have Sibo, at the end of the group, the first 6 weeks, your actually symptoms have improved so much you don't want to go on and do any of the killing. And that's fine too. I want you to have the flexibility to decide what works for you. Do you have to be a patient of mine to do the program? Yes, you do, because I'm prescribing treatment to you. That being said, you can come from another practitioner, be referred into the program. I will do the 6 weeks with you, and then I send you back to your doctor, your family doctor, or your naturopathic doctor with a letter of sort of how things went and the treatment plan we did. You do not have to switch your care over to me, and I would actually encourage you to stay with your primary practitioner because my one-on-one practice is pretty full. But if you're not a patient of mine and you don't have a doctor or a family doctor or a naturopathic doctor and you want to do this program, you just need to do a little short 30-minute consult with me first. You become my patient, I make sure the program is right for you, and then you can start. Are the sessions covered by insurance? They are, because they're naturopathic sessions, so they are completely covered by insurance, and I just bill every visit as if I would a regular visit. So you'll get a little naturopathic receipt after each session. I'm sure some of you by now think you have Sibo, so can you get tested? Yes, you can. We can arrange that to get you tested during the 6 weeks, not a problem. We can certainly do that. So the pricing for the group is pretty amazing. I'm able to give it at a huge discount because I'm seeing more people at once. So the package for the 6 weeks is $139. And then each session with me is $99 instead of $299. So instead of being close to $2,000, it ends up being $733 for the whole 6 weeks, and you don't have to think about it. Now, I don't bill that up front. You pay for just your supplements and your first visit, and then you pay for the rest of the sessions as you go, $99 a week, and then I give you your receipt. There are only a few spots left. Like I said, if you're interested in it, go ahead and register. I don't have a cap on it, so you might actually be able to register, and I may have to call and say, we filled this group, but I will call you and see if you want to go into another group if we have enough people to make a second one. Because I am so grateful that everybody showed up today. I cannot believe how many people showed up for this webinar. I wanted to send a little thank you out to the first 3 people who do register for the program. I want to give you that 30-minute gut consult for free with me. And that consult is normally $149. So I'm happy to give that to the first 3 people. And this is the link where you go to sign up. I think Maya is going to drop it. Oh yeah, she's on the ball. So you can just click on that link to register. So like I said, registration doesn't guarantee enrollment. Obviously, the faster you do it, the better, more likely to get into those last few spots for the Wednesday program. But if you're open to doing it, just register and we will be in touch with you to get you in to see me. And that is everything. So if you guys have any questions, I will take a look at my Q&A board here. Can Sibo play into environmental allergens? That's a great question. It does play into environmental allergens. So if you think about having Sibo, everything is activated. You have an infection, essentially. It's just the infection is living in the wrong place in your body. And so everything is very inflamed. And once everything is very inflamed, our reaction to the external environment, to other allergens, is going to be heightened. On top of that, it causes a leaky gut. And when we have a leaky gut, things spill through into the bloodstream, and then we can mount an immune response against those things. So I do often see when people clean up the Sibo picture, their environmental allergens tend to decrease quite a bit. Someone else is asking about yeast overgrowth. That is a great question. So there is actually a condition called SIFO, which is small intestinal fungal overgrowth. We don't know as much about it. We don't have a way of measuring yeast in the small intestine, but I think it's pretty safe to argue that if the bacteria can climb up there, I think the fungus can climb up there as well. The nice thing is the treatments that we use actually target both bacteria and fungus. So usually people will feel better no matter what condition they have, but it is a really good question. Okay, I can see this other one, Maya. Okay, so I think what I'll do here for this person, I'll just write back to Maya email because it's a bit specific to your situation. Actually, I can probably answer it as a general, asking about breastfeeding, currently pregnant and breastfeeding. It's a great question. So there's a lot of that first 6-week program that is very gentle, very safe. Definitely the dietary stuff we could do together. You could definitely take the program. I would obviously need to know that you're pregnant and breastfeeding. And so we might make a couple of modifications, but everything else would be fine for you to do. And you'll learn a lot, definitely. And probably better to learn that stuff before the baby comes, since you're going to be a little bit busy afterwards, would be my guess. Any other questions? Let me see here. I think that's everything. Wow, 5:55. Pretty amazing. All right. Well, if there isn't any other questions, I want to thank all of you for coming. I really appreciate it. And if you have any questions or anything, you can always send an email to the clinic. My office manager, Maya, is on here. It's info@somersethealth.ca. And we're happy to answer any questions that you guys have. Some of you sent in very specific questions, so we're going to email back to you privately to give you those answers. All right, take care, everybody. Have a great rest of your night. Bye.